Hello and welcome to episode 7 of Cmtv. I'm Aubrey Going.
And I'm Alison Kavanagh.
So we've had quite an interesting week. We had Ann Davey over from Massage and Myotherapy Australia. We recorded an interview with Ann, which we're going to show you guys in a few minutes. But it kind of sparked a bit of debate between the two of us.
Yep.
I think you were particularly interested in one of the aspects that Ann was talking about.
Yeah, the benefits of massage for the ageing population.
I think that's a big topic. We were talking quite broadly, you'll see the interview in a few moments, about a couple of different projects that we have coming up and kind of our vision for where we would like to see and help the industry to progress to over the coming years. So do you want to maybe start with the ageing population item? Because I think that's quite a good one.
Yeah, the conversation with Anne did spark an area of interest, which is around quality of life issues, particularly health-related quality of life for the ageing population. So because that's growing, Anne mentioned in Australia it's about 16% of the adult population is 65 years of age or over. It's actually 19% in Ireland. America somewhere in between the two at about 17%, and Japan is 28% of its population is 65 plus.
Yeah.
So some of the considerations around this were around how to keep people at home for as long as possible and what factors influence that.
Yeah, I think normally when they talk about ageing populations, they talk about the, financial implications for an individual country, where obviously having a larger working age population, people that are contributing to the tax base and things like that, that would hopefully fund care for all of us as we get older. And so it's always a little bit of a concern when the demographics tip and there's an older population and the younger population has to saddle a burden of the financial support for pensions and care and hospice and medical treatment and all those kinds of things. But for us in the massage industry, I think our interest was, well, what can we do about that? Yeah.
So really, it's the benefits of massage around improving mobility and reducing pain. So the factors that will keep people at home for longer is that they can manage their day-to-day activities themselves, but still feel connected, integrated, part of the community.
Yeah. So when we were looking at that, you came across different kind of quality of life markers, and we found a paper dating back to 1998 from the WHO, where they had kind of outlined, they described them as different domains. Mm-hmm. So there's slightly different terminology used in different places within the literature, but it was interesting where a lot of them kind of coincided with the things that we'd outlined, and then we had a couple of other ones. So I think the first one was physical was the first kind of arena, and obviously that's a big one.
Yeah. For in the health related quality of life and being able to manage your day-to-day activities and things like grip strength, being able to open jars and cook for yourself and markers like that, that if you have taken care of good muscle tone, dealing with restrictions as they appear, having good proprioception, which improves balance, gait, and ability to perform your activities.
Yeah.
And massage, I think, has a big influence on each one of those.
I remember years ago looking at this and they were talking about, where we might sometimes refer to like the aging population, that you can't make certain assumptions. Like there's kind of, I think sometimes this presupposition that people who are elderly are all going to be frail, but they actually fall into several different categories. Many people are robust, both in their physicality and in their overall health, even into advanced years, which is what we're all hoping for and aiming for. But there may be greater considerations that we might have to make for somebody who is more elderly and frail. And one of the things that they use as markers or like an index of how robust somebody is grip strength. But they say that's very correlated to really, I suppose, how much time you have left and how much quality of life you have left. Mm-hmm. So maintaining grip strength is considered to be, it might not seem that obvious, but it really is when you think about being independent and being able to do things for yourself. The simple thing, like you mentioned, like opening a jar, that's very tied to grip strength. But there's surprising correlations where they'd say as these things decline, overall health is going to decline more rapidly as well.
Yeah.
Yeah.
Another influence is the emotional state, that as we age, we may have less and less connections and contact. And loneliness and isolation are big factors for people living alone. So the massage therapy means that they're interacting with somebody. You also have the influence of touch in relation to the release of hormones such as oxytocin, feeling bonded, cared for, nurtured, and a reduction in cortisol and adrenaline or epinephrine, the stress hormones. So it kind of fulfills a lot of those gaps that are occurring as people get older and maybe feeling less connected within society, that it'll plug some of those by engaging through therapy.
The oxytocin one is an interesting one, isn't it? Because it's oftentimes referred to as the love hormone, and they'd say like very important during bonding between infant and mother. But then they talk about boosting oxytocin by things like I think it was a 30-second hug. But you think about the duration of a treatment and where the person is engaged in therapeutic, compassionate touch, for that long a session, and how that's not just going to be purely a chemical release of hormone, but how it influences us psychologically and how we see ourselves in relation to the world around us and our social connections. So it's a lot broader than just looking at it as like cold physiology and, it's just this hormone and it has this function, that the psychological overlap is enormous.
Yeah.
Yeah. Interesting.
Biopsychosocial, so kind of plays into all of those.
Slightly overused term, but it is valid. Yes. Yeah. The biopsychosocial. Yeah, definitely. Yeah.
Yes. So I just think in terms of intellectually engaging with people, it's very useful that you're engaging your faculties. So the old, if you don't use it, you lose it.
Yeah.
That, it is important to engage the intellect as well and have conversation and interact with people.
I remember coming across a really interesting paper a number of years back as well, and it kind of ties into this, where we oftentimes, like, it's kind of recognized now, the whole brain training kind of thing, keeping your mind engaged, doing different quizzes, puzzles, crosswords, things like that. But they also talked about the doing of physical tasks actually is really good for maintaining mental clarity and focus as well. And a paper that I read years ago, they were talking about not the elderly receiving treatment, but instead they trained elderly people in the performing of massage. Now, obviously, these are people with reasonable quality of life. They're relatively robust. They're able to study and then practice this. And they had them do treatment on like their grandkids. I think it was scalp massage or something fairly, quite straightforward, but yet compassionate touch. The elder person feeling like they actually have more of a role in their grandkids' life. There's that direct contact, which is oftentimes missing from modern society. We get so afraid of physical contact in some regards. But they found that those markers of quality of life, they had things like, the number of doctor visits, the reported pain, the amount of medication required, I guess particularly pain meds, but I think medication generally, that when people feel better and their health is better and their stress is lower, their health oftentimes improves. And that lifts some of the burden of medication and all those other factors of doctor's visits. So they could actually see a marked improvement just in quality of life markers from them learning a new skill and then integrating into that kind of family purposeful activity. And it had a remarkable effect. So it's not just, we always say it's not just about the receiving of treatment. The person giving treatment actually benefits an awful lot from therapy as well.
Yeah, and you think of traditional Ayurvedic treatment where touch is incorporated into everyday part of family life, and it's generational, that it is the giving and receiving of treatment, and it keeps those bonds and that connection and interaction alive.
Yeah. So from the WHO's list, we've talked about the physiological benefits, or these markers of health or well-being. Emotional level of independence is the third domain, that the person is physically independent, which kind of plays into the physical robustness and things like that as well. But that they're able to, most people, if you ask most people that are getting into advanced years, they would rather remain at home, but they need that level of independence in order to do that. They need that level of physical robustness and so on. We talked about the social factors. Environmental factors is an interesting one as well. Oftentimes you see how the environment has to be adapted as people start to lose mobility. And something I thought of when we were chatting about this earlier was it's oftentimes kind of a domino effect, that one of the things we'll mention when we're chatting to Anne is we kind of set sort of a lofty goal. We were saying, like, wouldn't it be fantastic if we got to the stage that literally everybody was engaged in receiving regular massage treatment? Not necessarily every week, but like periodically, because there's that old adage of a stitch in time saves nine.
Yeah.
I think of it like dominoes. They talk about it, some tiny number of dominoes, something like 7 or 8, or maybe as many as 9, from a small, like 1-inch domino to something that could knock down a building.
Wow.
That literally the knock on, the domino effect, as each domino gets proportionally bigger, the degree of force or the impact on outcome is so much greater. If we think about this as early intervention being the small domino, if we can stop that domino from falling by receiving regular treatment in the earlier and middle stages of our life, if we can maintain better mobility, so our soft tissues are able to shorten and lengthen properly, our joints aren't compromised, they're not being compressed and wearing out cartilage, and we're not developing arthritis. And if we can then keep the neurology, the proprioceptors around the joint healthy, then we've actually gone a long way towards stopping that very first domino from falling. Because otherwise, if that domino falls, as things start to stiffen up, we lose proprioception. As we lose proprioception, we lose stability and mobility. So we're more prone to falls. And most people find in advanced years, falls can be quite serious. Fractures are easier to happen. A lot of people will say that if they break a bone as an elderly person, they say you may not recover. You know, there's some frightening statistic about the number of people that suffer, elderly people that suffer femoral fractures and the likely mortality rate, which is kind of scary.
Yeah.
So catching it early, big impact on that independence and the environmental part as well. I thought spiritual was an interesting one.
Yeah.
I think in a lot of cases, people probably think of that in terms of religion, but I suppose we would have the broader approach of connecting with yourself, meditation, breathing exercises, maintaining a sense of self, and a kind of connection to the broader environment, or I don't know what way you want to describe that, if you want to elaborate.
Energy, yeah. No, exactly right. And just to covering some of the issues that face the aging population in terms of loneliness, isolation, loss of mobility and grip strength, loss of independence, loss of social standing, loss of meaning and purpose. So how can massage mitigate some of those issues? So I noted that, you know, increasing circulation, helping with better balance and more stability, better proprioception, pain reduction, reducing the stress hormones, cortisol and adrenaline, and maintaining social contact and interaction.
Yeah, and what's interesting about a lot of those points is, you know, we've just talked about the benefit of early intervention, but intervention at any stage along the process of aging, because we're all aging from the time we're born, but through that process, particularly what we normally think of as the decline in our later years, intervention at any stage is going to benefit all those things.
Yeah.
Wouldn't you think? Yeah.
Definitely. There's just some points then to consider when working on the more fragile age.
Oh, yes. Of course, the part that's going to be most applicable to therapists. Great. Yeah.
So just to consider the client's skin condition. So if the skin is more fragile, use a lighter pressure, shorter duration treatment. So you might just do a half-hour treatment instead of 1 hour, and maybe even just more focused to areas like the hands, the feet, the face, the scalp, that it's more focused and just more gentle. Slower pace, lighter pressure. You're taking into account then if there's any loss of sensation. So any influence on the nervous system, you could either have very sensitive skin, or you could have loss of sensation if there's some impairment on the peripheral nerves. So adapting your pressure accordingly and being aware of what medication the client is on. There can also be issues around temperature regulation, maybe feeling a little bit colder than normal. So making sure that you have extra layers and a cozy environment to provide a treatment in.
Yeah, and I suppose when people are frail, there's oftentimes kind of like fat loss as well. So like not only is the skin thinner, that kind of insulation layer, so the greater sensitivity to any kind of heat or cold.
Yes.
Yeah.
So that's something to be mindful of as well. And obviously on the safety side, if in doubt, refer out. That if there's anything you feel is beyond your scope or that you're not comfortable treating with or you have a concern about, make sure to get them to check up with their GP before receiving treatment.
Yeah. I think an interesting point, just coming back to the idea of doing like short duration treatments, that you might just do treatment on the hands or the feet or the face. Those three in particular are really interesting because of the rich innervation of the nervous system. You know, compared to other areas, like everybody loves a back massage, but the back actually has a relatively low density of nerve endings compared to hands or feet. Like think about how sensitive your hands are. So the benefits in terms of the impact on the nervous system is going to be greatest working in those areas.
Yeah.
But also we mentioned about the idea that the effects of treatment can oftentimes be almost parallel to exercise. That you'd say gentle treatment is like gentle exercise, going for a walk.
Yeah.
And if the person has poor mobility, those things are impaired, those options are not available to them, treatment can sometimes bridge that gap.
Yeah.
Absolutely. And conversely, we would say like a heavy, vigorous treatment would be like a heavy workout, which wouldn't be suitable in that circumstance. So you're going to keep it less vigorous, lighter pressures, check for medications.
Yeah. Sensitivity.
Temperature
regulation.
And if in doubt, refer out.
Yeah.
Always an important one.
Yeah. So I think we have an awful lot of benefit to offer the ageing population, which is increasing. And there's definitely a case for including massage therapy to mitigate some of the what's considered negative impacts of the ageing process.
And people oftentimes are looking for a niche that interests them, a particular kind of demographic within the population that particularly appeals to them. And I think the kind of people, say, who go into nursing and caring professions, they oftentimes have that very compassionate kind of approach. And there are people that are particularly drawn to the idea of helping the elderly, improving quality of life. And it's a mutually beneficial service, because if you enjoy that type of work, you like that caring aspect, you're maybe not as interested in deep tissue, kind of the kind of stuff that I like, the kind of corrective manual therapy, that kind of compassionate care can be a really good niche for a lot of people, can be a really good fit.
Yeah.
And it really benefits the people, particularly like kind of in like nursing home populations and things like that, where they oftentimes are isolated. There's an element of boredom, all those kinds of things can be fantastic.
Yeah, if there's mental decline and so on, that there's a study that showed that people with dementia and maybe aggressive behaviour with that it really calmed them down, getting weekly hand massage.
Yeah, where that disorientation oftentimes will lead to a lot of agitation. Yeah. So interesting. Good.
Definitely an area worth exploring.
Good. Anything else to say on that before we
I think
move into our clip with Anne?
Pretty much covers it.
Yeah. So as I said earlier, we had a great conversation with Anne from Massage Myotherapy Australia. We're going to talk about things like the introduction of more kind of technology in education, particularly in helping to make the learning of anatomy visually stimulating, really interesting and easy to digest and absorb. We're going to talk a little bit more about that treatment of the elderly, and a little bit about kind of education, legislation, and where the industry is going in Australia and how that might influence other industries or awarding bodies or associations in each jurisdiction around the world. So let's have a chat with Anne. I'm delighted to be joined today by our very special guest all the way from Australia, Ann Davey. Hi Anne, how are we doing?
I'm good, thank you. Thanks.
Welcome to Ireland.
Oh, look, it's so exciting. I've never been here before. So
excellent.
And to come and visit you.
Yeah, fantastic.
Yeah, after all these years of our collaborating.
Yes, because we've been working a lot with Massage Myotherapy Australia over the years. I think since it was 2018, thereabouts.
Yes, I think that was the first time you came.
Yeah, to Australia, yeah. Ooh. And been back over, was keynote speaker for the combined between Massage Myotherapy Australia and Massage New Zealand in Auckland.
2023.
2023.
Yes.
How time goes by so quickly.
It does.
And I'm really excited about the latest project we've been talking about. While Anne was over here in Ireland, we've been discussing kind of the future of education, collaboration around the world across the various branches of the massage industry. But one of the things I'm really excited about was some of the online education and some of the developments in that area. I don't know if you want to talk maybe a little bit about that, Anne?
Well, it's been great because we've been working with you. We've got one of your modules one or two, a couple of your modules on our online learning platform, which is fantastic to have. And now we want to go one step further and include some augmented reality. And, it sounds, something virtual reality, artificial intelligence, it's all very
Sounds
scary.
like science fiction.
But augmented reality, my vision for that is to increase the students' capacity for learning and to be able to look at something and see what's happening underneath and where things are, mostly in the anatomy.
Yes,
is the main area.
I think for a lot of people, that's kind of a daunting subject in and of itself.
Yes.
Because of the nature of the terminology, it is kind of technical. But then there is that really useful, clinically applicable aspect to anatomy.
Yes.
And I think if people have that visual driver that they can see things, as you said, like seeing through the layers,
Yes.
it kind of helps to develop their practice, makes them more targeted in the treatment they're doing, which is going to increase their treatment outcomes.
Absolutely. And, visual learning, we talk about somebody being a visual learner. I think everybody is to some capacity, because you can read a book, you can understand it, but to actually physically see it in virtual reality or augmented reality that we're working on, it is just going to improve everything. So, I'm really excited about it, and I think it is out there for a lot of other industries, but not for massage.
That I think that'll be a nice kind of integration to bring that in, where people can actually get to grips with some of those kind of jawbreaker names, become friends with the muscles.
Yes.
Like we'd oftentimes say to people starting out on their first training course at foundation level, we'd say, you've got maybe 80 muscles you've got to learn, and you've got to learn their location and their action. And I'd say, if you met 80 people, would you remember their job, where they're from, and what they do for a living?
Yeah.
Not a chance.
Nope.
But as you socialize more and more with those people, the more familiar you get, the more you'll remember, the more it integrates into what you're doing.
Yes.
And then, as we said, it's actually going to make you be able to specifically identify a particular structure, a particular muscle, and then effectively treat it.
Exactly.
Yeah.
And so then, whilst you won't have that augmented reality when you're treating, you can visualise it and understand what's actually going on, what you're looking to feel for, what you're looking to do.
Yeah. So what we're looking at developing really is something that kind of integrates some augmented reality with palpation skills and assessment.
Yes.
So we're really looking forward to that project. It's going to probably take a couple of years to really get done.
Absolutely.
But this is the outset. This is the start point, and it's going to be interesting to see where we progress from here.
Oh, look, I'm very excited about it, and I think it'll be great to work together.
And you were talking as well about some of the programs for education in Australia, and how Massage Myotherapy has changed one of its qualifications. You were talking about a title change, or?
No, what they've done is they've rewritten the health training package. So it's a national health training package, and they've included a couple of extra units of competency, one being pain neuroscience and the other one aged care. And I think that will also enhance the practice for the graduates coming out. We know that 1 in 4 people live in chronic pain in Australia. I don't know if that's an international statistic. And so the benefits of massage for chronic pain are well documented, well researched. So to add pain neuroscience to that program is fantastic.
And it has become a very popular area of study that is oftentimes, I think, referenced but not in detail.
Correct.
So it'll be interesting to see a lot more of that integrated into therapy practice over the coming years. I think that's a fascinating area, the neuroscience, but also the idea of really helping to treat an aging population.
Yes.
Because I think most of the world is seeing this, certainly most of the Western world.
Yes.
And again, well-documented research on the measurable, what they call quality of life markers. And there's a lot of research available on this where they talk about how massage therapy actually helps to improve across each of those markers for quality of life. You were mentioning earlier about like the person who can actually just walk out to the mailbox, walk to the end of the street.
Imagine the mental health capacity that would improve, because it's a sense of achievement. That's you take it down to the basic. And if massage can help somebody just do that in the short term, what can it do in the long term? Walk to the shop, get in a car and drive. You know?
Mobility.
open up the world to them, really.
Yeah, exactly. And we've also been working with Laura Mosley, who some of your viewers may know, from Pain Revolution. And he's got a program, a local pain educator program, and we're helping to write the competencies for that program, but for other healthcare workers, so not necessarily a bachelor qualified worker. So it could be a carer, could be a massage therapist, and that's really exciting.
Yeah, so we're interested in finding out more about that. So stay tuned. We'll have more information on that as it unfolds, because it's something that I think would be very useful to therapists in this part of the world as well.
Absolutely.
Yeah. I think it's definitely something that could cross borders.
And I think everything can cross borders. As you know, I've been to the Canadian conference last week, which was very exciting with the RMTBC. Too many acronyms. But also talking to yourself, talking to people at the conference. Across the world, we have the same challenges in this industry, good, bad, or otherwise. Same successes as well.
Yeah.
You know, with research and, you know, the growing industry and being embedded in the health sector. Yeah. But we've all still got that challenge of recognition.
Yeah. And it's nice to see how in one jurisdiction you might have a particular organisation, whether that's an awarding body or an association, make headway in some aspect of our industry. And then everybody benefits from that.
Correct.
So we've seen a certain amount of that in Europe. We've seen some of it come from the US, and we've certainly seen some of it come from you guys in Australia.
Oh, I mean, the most recent one is the Department of Health and Ageing in our Australian federal government has included massage in the home care package, which is a first. So it's recognised, publicly funded for home care massage for the aged.
Excellent.
Yeah.
So that's something that's of real value to a very important demographic within our community.
Yeah, absolutely. And that's a real win, for want of a better term, that recognition.
Yeah.
And the other small win, you've got to celebrate all your wins, don't you? is being involved in the development of the digitisation of health records, which then means that our members or our practitioners in Australia will be able to access their patients' healthcare records.
Yes. I thought that was very interesting that you were saying that this is across healthcare.
Yes.
But massage is being included.
Massage is being included, absolutely, which then means that when your patient gives you permission to access their record, their GP, who has permission, can see your notes, and then they can see what has worked and what hasn't.
That'll be very interesting to track over the intervening years to see, does it actually increase awareness within the broader healthcare industry?
Yeah.
That if people are looking at the record charts for people attending a massage therapist and they're seeing benefits in real time like that, I think oftentimes it will encourage investigation, if nothing else.
Absolutely.
That you may have other healthcare professionals then going, oh, I'm seeing these benefits in my patients that are seeing a massage therapist.
Yeah.
Look at the chart, see what's being done. Separating out, I think, even the difference in our industry. We've talked about this, the kind of levels of qualification and how some people really excel within the kind of general relaxation model and are happy at that level. And then other people progress onto corrective work. And if doctors can see, well, the person who's getting this type of therapy is seeing a benefit for this condition, this person with this other condition is seeing a benefit for this, it kind of helps them to calibrate what might be useful if they were to refer. Are they going to refer somebody, say, suffering from high levels of chronic stress to somebody who needs a lot of relaxation therapy?
Correct.
Somebody who is maybe suffering from chronic pain, going to a specialist that's going to be able to address their issue.
That's right. And I think possibly part of the problem is that their specialist or their GP doesn't even know they're having massage therapy.
Again, a problem, I think, all around the world. Yes.
And also educating the public of the benefits of massage, because you know, as a society, we rely on our local doctor to tell us what we need. But if we can educate the public the benefits of massage, then maybe our patients can educate their medical fraternity of the benefits. So having all of the records there at their fingertips, it's a win-win.
Yeah, I think that's sometimes maybe a little bit of a blind spot for therapists, that when we think in terms of the public, we think in terms of our clients.
Correct.
But that's only a small cohort.
It is only a small cohort.
Yeah, there's a huge amount of the population that has no idea of massage, never gets a treatment, isn't aware of the benefits at all. That if we have that greater integration, we should see a greater penetration into the wider population, which is going to benefit them, of course.
Absolutely, but also the public need to know what is a qualified massage, health-related massage therapist, and what is a day spa.
Yeah. And pick the discipline that suits their needs.
Exactly. So it's, it's our hopes and dreams are that everybody in the world has a massage.
Yes, hopefully that day will come. Well, Anne, anything else you wanted to talk about before we wrap up?
No, I'm just very excited about the project that we're going to work on. And here in Ireland, I've never been here before, so it's a fabulous place. And I'm looking forward to a little holiday now.
Yeah, you're going to tour a little bit around the West Coast and stuff. You're going down by Dingle and places like that. Yes, very popular spot. Yeah. I'm sure a lot of our people watching this, certainly those who are based here in Ireland, will have been and can send you the same ringing endorsement that we would.
Oh, good.
That part of the world is beautiful. Ring of Kerry is absolutely fantastic.
Oh, lovely.
And for our international audience, come over and have a look for yourself. Well, Anne, I really appreciate you taking the time to come in and talk to us. It's been really illuminating talking about what's going on in the broader industry within Australia, how massage is integrating into other areas of healthcare, and this upcoming project that we have, hopefully bringing in that technological part of augmented reality into learning.
So stay tuned.
Yeah, we'll update you guys as more information becomes available.
Very exciting.
Thanks for watching, and we'll see you guys again soon.
Thanks.